They as follow: Erongo 90, with Swakopmund having recorded 49 new cases and 7 reinfection. Walvis Bay 37, Omaruru 4. Followed by Comas with 58 new cases, of which 15 are reinfection. Karas 32, with Luderes having recorded 21 and 1 reinfection. Keetmanshoop 9 and 2 reinfection. Karasberg 2 and 1 reinfection. Omsati 27, with Ochikuku having recorded 15, Otapi 12 with 1 reinfection. Ochavundupa 16, with Ochivarongo having recorded 7, Okahanja 6, Grootfontein 3 with 1 reinfection. Kavango East 16 from Rundu and 5 reinfection. Ohangwena 8, Congo has recorded Ngera has recorded 1, and Okongo has recorded 7 with 3 reinfection. Zambezi 5, Kunene 3 from Opo, Kavango West 2 from Kurankuru, Oshana 1 from Oshakati. Among them, there are 61 learners from different schools, 19 healthcare workers, 7 teachers, and 3 students. 10 cases have received 1 dose of COVID-19 vaccine, 48 cases are fully vaccinated, of which 10 have received a booster. 40 cases are not eligible, and 198, they are not vaccinated. We have recorded 990 recoveries from the following regions: Comas 785, Choganjupa 95, Erongo 63, Hardap 45, and Kunene 2. The number of active cases is now 2,032. 62 cases are hospitalized and 6 are in intensive care unit. 5 cases of those hospitalized have received 1 dose of COVID-19 vaccine. 5 are fully vaccinated, but all those who are admitted in the ICU, none of them is vaccinated. The cases are as follow. Comas 22 admissions, Erongo 8, Umsati 8, Kavango East 7, Ochodangupa 4, Karas and Oshana 3 each, Hardap and Oshkoto 2 each, Hambwena, Kunene, and Zambezi 1 each. On the positive side, no death was reported during the period under review. By the 30th of May 2022, a total of 466,434 people aged 18 years and above have received 1 dose of COVID-19 vaccine, which represents 32.0% of the target adult population. 145,077 have received the Johnson & Johnson vaccine, while 263,062 adults have received 2 doses of other vaccines type. So in total, 408,139 adults have completed their vaccination schedule, which translates into 28% of the adult target population. 22,798 children aged 12 years and above have received one dose of Pfizer vaccine, which represents 7.4% of that target population. Of this, 11,406 are fully vaccinated. Therefore, the cumulative number of people vaccinated with the first dose of COVID-19 vaccine for both adults and children is 489,232, of which 419,545 are fully vaccinated, translating into 23.5% of the overall target population. 66,205 people have received the booster dose. In terms of summary, now the cumulative number of positive cases since the beginning of the pandemic now stand at 163,874. The total recoveries 160,574, giving us a recovery rate of 96.3%. Number of deaths 3,697, of which and 341 are COVID-related deaths, which gives us a total number of deaths involving COVID-19 of 4,038. The total number of samples tested since the beginning of the pandemic is now 1,039,597. Total number currently in quarantine facilities, 1,460. Before I conclude, I would like to point out that we are now observing a sustained high number of cases over the past weeks in the region between 100 to just below 300. We also noted that COVID-19 patients who are admitted in the ICUs, all of them are not vaccinated. I therefore wish to appeal to public that we should not allow the situation to get out of hand. Again, we emphasize the benefit of being vaccinated. We have the means to prevent further increase in the number of cases. Let us just get vaccinated. I thank you.
Thank you very much, Dr. Kalumbi, and I do hope that many people heed your call, especially looking at the fact that winter is now full on. And it is very much that time where we need to take care of ourselves, especially if we do not want a repeat of last year. So thank you very much for this afternoon's update, Doctor. Getting back to our topic for this afternoon, and also just taking in reference with what Dr. Kalumbi Shangole just stated, we are standing at a 23.5% vaccination rate for the country. So hopefully that number can increase and many more people can be saved through that particular manner. In the studio this afternoon, I have Mr. Ervin Nakafingo. He is the Deputy Director for Health Information Systems with the Ministry of Health and Social Services. Good afternoon, sir.
Good afternoon, ma'am, and thank you for having me.
Thank you very much for availing yourself to be with us this afternoon, and we are trying to tackle or at least get answers for an issue that has recently come to light and is really inconveniencing a lot of people, especially our travelers. COVID-19, when it hit our country, blew us around like headless chickens with regards to trying to progress without necessarily creating risk of infection. But at the same time, it did teach us other ways of doing things, and most of these manners of operation or the operatus operandis became the technology side of things, mind you. And in this is where a lot of e-versions of things were developed, and hence us talking about the COVID-19 e-version certificates this afternoon. Dr. Nakafingo, starting off, we would like to know, what is a travel trusted test code? How is it generated? And how long is the validity of such a code?
All right. Thank you very much. I really appreciate this opportunity to engage with the public with respects to the digital vaccination certificate. I see that you are using a term, the e-version, and I don't know whether the public would also appreciate that it is the same terminology, more or less. I think the most common word that is out there is actually the digital vaccination certificate.
Yeah.
This is basically a tool that was actually introduced. It's actually a global trend that was introduced as a form of verification to verify that the fully vaccinated individuals have indeed been vaccinated or have received vaccination doses as per the prescriptions of the requirements. But of course, this digital certificate itself, it's it is actually a documentation that is having a QR code, and it is actually introduced to ease travel for the public. So basically, in a nutshell, I think that is all what the public may need to know, that this is actually a tool that was introduced to enable them to be verified, that they are indeed verified, particularly at the destination countries where they are going.
Okay. Who is eligible for this?
This certificate is actually eligible to those ones that are fully vaccinated.
Okay.
Yes, so you need to be vaccinated, you need to receive all your required doses of an antigen of choice. That's when you will be eligible actually to get it. But of course, we are also not necessarily saying, at this point in time, we are not saying that everybody may need to have this digital certificate at this point in time, but it depends on the country also where you are going.
Okay.
We are advising the public to say those ones that are traveling to a country that requires a digital certificate, those are the ones that really need to approach the ministry or to engage with the system and apply for it, but not necessarily just a good to have document per se. But of course, we can see that the future is towards making sure that everyone is eventually having that digital certificate at hand.
And where and how does one upload your vaccine cards? And do you also, or can you also upload your PCR test results on this system? What can you upload, and where and how do you do it?
Well, the process actually starts with the traveler, for instance, planning a trip, going somewhere. But it may also start with gathering information as to whether the destination country, whether it requires that particular digital certificate or not. And with that, then, of course, we do have a system that was already introduced way back last year. And that is the same system, the trusted travel system, which started offering the COVID-19 laboratory test certificates. So this particular system is the same system that is having a module customized to issue the digital vaccination certificate. So of course, the public or the travelers would need to create their account on the system, and once they create the account on the system, they upload the vaccination records, after which they will be actually issued a provisional certificate. And after that, the ministry staff would need to get in and verify the vaccination record as uploaded. So which will of course then issue them a vaccination certificate without that term that is actually commonly known as a provisional certificate. In fact, the provisional certificate that is issued may not be taken to mean that that is a document that you can actually take to travel with. That is still provisional, meaning that an authorized staff of the ministry need to actually get into the system and verify that before a traveler is authorized to actually use that particular document.
Okay.
Yes.
I've got more questions on that, but we'll come back to that a little later on. I come back to, as an individual, and I want to upload the system or my details onto the system. Can I do so? Where can I do so? Is there a website maybe that I am supposed to link to or so on? And also, we come back to the fact that not everybody is privy to how certain things work. And sometimes people struggle. And that is what brings me to my next question as well, which is, what can a person then do if they are struggling with the self-upload option? And is there a waiting period until one receives his or her digital certificate with that QR code?
Great. Thank you for that question indeed. Yes, there is actually a self-upload option embedded in this particular system. And for a traveler who is struggling or may not have that knowledge of what to do, we have actually given out a public notice where we are advising the public to reach out to our call center, and at the number that is actually provided. I think it's commonly known as a 0800 100 100. So there they can actually be guided by the staff that we prepared and trained on how to actually upload. But of course, we are also saying, you and I, for instance, if we are struggling or we do not know how to do it, we can actually also ask someone, not necessarily that you may only need to come to the ministry, but you may have someone also, let's say, for instance, a neighbor or a friend or a family member who is familiar with this technology thing. We know for sure that our people are not, quite conversant with the technology. And of course, that those are the other mechanisms that we can also use to get assistance. But of course, we are advising our public to reach out to our call center and get assisted with uploading the system. But also, there is also an SOP, the standard operating procedure, that is available, and it can actually be accessed through our ministry's platform, social media platform, and also on the ministry's website.
Okay.
So we have provided that one there also.
Okay.
So that SOP provides the step guides on how to create an account and up until to upload, until such time that you'll be given a digital certificate issued out.
Okay. So there are options, and the steps or guidelines of how to go through the procedures seem to be widely available on these platforms. There's a website that is displaying on your screen right now. That is where you can kick off, and where you get stuck, you can always reach out to the Health Ministry officials on their call center number, which is 0800 100 100.
Yeah.
0800 100 100. That's the call center number for the Ministry of Health in that case where you need assistance with the system on the website that is being displayed on our screens. At this point, we would like to invite you as our viewer to take part in the conversation. If you have any questions, you're welcome to call in and place those questions to Mr. Nakafingo. Our call line number is 061 400 397. 061 400 397. Unfortunately, this afternoon we are unable to collect or gain those comments from you through our social media platforms due to technical issues that we are having, but hopefully by tomorrow we will have them sorted out. Continuing with this afternoon session, the next question: does the Ministry of Health have a digital or even a non-digital database for vaccinations and COVID-19 tests?
Thank you very much. I see that you are referring to tests, COVID-19 tests.
Yeah.
The very same system actually collects data on the database of those ones who conducted the test. But of course, we are actually talking about the digital certificate. But of course, the very same database allow us access to the historical events with regards to the tests that are conducted.
Yeah.
Because our labs are actually, also uploading this information on the same database, on the same system.
Okay. We have a caller on the line right now. That is Black from Windhoek. Good afternoon, Black. How are you? Hello? Caller, hello? Okay. Hopefully we can get Black back on the line. While we wait for Black to get back to us, we would like to then ask our next question to Mr. Nakafingo. Last week, and I'm sure you were anticipating this question. Last week, many of our Namibian citizens were amongst the many people that were stranded at the OR Tambo International Airport because of vaccine cards not having a QR code. We do trust that this situation has been sorted. Okay, before I continue with my question, Black, thank you for getting back to us. How are you?
We are doing fine, ma'am. Yourself?
No, we are blessed. How would you like to add your voice to the conversation?
I indeed am actually having a question to the Mr. Nakasingo.
Yes.
When I upload my certificate, can I use only one passport, or should I? Because some of us, we are having an official passport and then a private one. You are traveling on your private capacity. Should I reapply when you travel in your private capacity, unlike to your official capacity, or can I use the same one?
Okay.
The same digital certificate.
Okay. No, we'll allow Mr. Nakafingo to respond to you on that one. Thank you very much.
Yes, thank you very much, Mr. Black, for the question. Very interesting one. This is actually the first time I'm getting across this particular question. I don't think we are going to advise the public to create digital certificates simply because of the differences in the passport. But of course, it is quite important to present the very same digital certificate and present also the passport that is actually shown on that digital certificate, because otherwise then we are going to be creating another room of a lot of people uploading these documents and reapply again. So I don't think it is really a problem at this point in time. You need to travel with both of your passport. If you have used your official on the digital certificate, that is the one that you should also show, because that is the details that they need to check whether your information that are on the digital certificate are the same with the ones that are on the passport. I don't think that should be a problem. But of course, these are some of the information that we may also need to take back home and try to iron out how to best actually inform the public moving forward. Thank you.
Okay. No, I think Mr. Black's question is actually a good one, because I'm thinking to myself, I'm listening to your response to it, and I'm thinking, but doesn't it create an immigration issue? If he's now forced to travel with both passports everywhere he goes because of the number that's on the digital certificate.
Yeah,
is that really right?
Yes, in fact, this one is just for verification purpose.
Okay.
You know, someone may come to say, but your digital certificate is having a different passport number. Of course, you'll be able to be in a position to explain and say, wait a moment. So I'm actually having this passport, but because I'm, on a private mission, this is the reason why maybe there's such differences. But I really do not think that should be much of a problem if you are to present those information. But for now, we do not have a provision of allowing the public to create a digital certificate because of the differences in the passport numbers.
Okay.
Yes.
That brings me to my next question then. Do we have our immigration officials as stakeholders in this particular exercise?
Well, yes. At this point in time, Namibia have not really introduced a digital certificate as a requirement of entry. So we are not required to produce digital certificates to enter malls, to to enter shops, and to enter offices. But of course, at this moment in time, we are issuing this digital certificate, although that is the next step also. We are issuing this digital certificate for outbound travelers, particularly because of the global demand that our people happen to find themselves in a situation where they need to present this digital certificate, and they most of the time do not have. And that is actually the reason why we are taking care of that situation.
Okay. Getting back to the previous question that I was busy with, last week, many of us might be aware of it, that our Namibian citizens were amongst the many people that were stranded at the OR Tambo International Airport in South Africa. And this was mainly because of vaccination cards that did not have QR codes. Now, our question is, silence followed that basically. So we do trust that the issue was sorted out. But the curiosity that arises is, the how. How was this issue sorted out?
Thank you once again. I really expected this question. I saw the news also in the media. I don't think that the ministry received any formal communication to say we have this specific number of people, but this was just more of the media reports. As we speak, of course, the South African government also have send out updates on their requirements of entry. And I think it's only not from the Namibian government or Namibians, actually. It could be from other countries as well. And they have issued out the communication to MIN to say they have noticed that there's quite a lot of inconvenience that are coming along because of the requirements. But of course, what we have noticed is that people travel to South Africa without the digital certificates. But of course, there's also an option that in the event that you happen not to have a digital certificate ready at the time that you're supposed to travel, you're supposed to do a PCR test. And it must be actually falling within the number of the required number of days as per the destination countries where you are going. At this point in time, what I will advise the public is that in the event that you have applied, and of course, we have given out to say that once you apply, we allocated at least 2 weeks before this digital certificate is approved, of which we believe and we still feel that it is even shorter given the number of the team that is working on verification. But of course, in the time that you do not have that ready, so we are advising the public really to confirm, first of all, to confirm the requirements of the destination countries where they are going, and to make sure that they have the PCR test. Really, they have done PCR test, because that is actually the second option in the event that you do not have a digital certificate ready. And that will really for sure cut out on unnecessary, what is the word? Unnecessary, situations where you will be kept hostage because of you not having that particular document to produce.
Are there any cost implications to the application for the digital certificate?
Well, at this moment in time, really, we are not, there's no cost attached. It's a free service. The one thing that I would like the public to know that there's quite a lot of processes involved. Of course, you need to verify that this person is indeed vaccinated, and those are the things that are kind of causing delay. But we are not asking any money of any sort for it. It's free.
We have Johannes from MICT calling us. Good afternoon, Johannes. How are you?
I'm fine. How are you?
We are well. How would you like to add your voice?
Yeah, I just want to find out what are the requirements for the travelers that are coming from other countries, coming into Namibia, say from Botswana, for example. What are they required to have in terms of the current health protocols?
No, we shall refer that question to Mr. Nakafingo. Any other contributions?
No, just that one, yeah.
No,
Thank you very much.
You're welcome. Thank you very much.
Bye-bye.
Yes. I think, like I stated earlier, we have not really introduced the digital certificate as a requirement of entry per se, but for because we do not, we know for sure that many countries have not yet implemented the the trusted travel.
Yeah.
And the requirements, I would actually want to refer this to my other colleagues.
Yeah.
I may not have specific details as per what is required for those ones that are coming in, but I was actually ready to speak to the digital vaccination certificate requirements per se.
Okay.
I would like to remit myself in that region for now.
Okay.
Yes.
Mr. Janus, as Mr. Nakafingo is advising, that at this point in time he does not have all the details and he would not want to misinform you. So maybe you can look into calling the call center number 0800 100 100, and they are well placed to give you the exact information that you are requesting for. Carrying on with our questions here that we need to pose to Mr. Nakafingo.
Yes.
One of the main reasons for the situation that took place last week is the absence of a global vaccination certificate template. Now, from your communications with our global counterparts, is there one in the making or not? But before you answer that, we would like to welcome the caller on the line. Good afternoon and welcome to the show.
Yeah, good afternoon. How are you, my sister?
We are well.
Yeah, good afternoon to your visit. Good afternoon, and good afternoon to listeners, my brother.
Yes.
Good afternoon, sir.
Yeah, thank you very much for having me. My question, my brother, I'm speaking to you. First one, you indicated that the travelers from Namibia and other countries, they need to have all these documents that you have said. My question here, what is your agent and the agent of the WHO or the disease center or any agencies from the ministry that are connected internationally and the immigration department and all other agencies? What are their proposals of they make possible by you first of all connect yourself as you have the global world connection, so that it's easy for the people who want to travel, who are stuck in the airport and other immigration departments. So you're able to finalize these things and connect the people that whenever they have issues, then this automatically document that they are presenting is given to them by these agencies. Because what about if the person lost his document? He got it and he lost his document. Nowhere to find. And then we have problems in most of the immigration sites. They charge you. If you are not able to have COVID, all the information that you have said, they charge you. If you do not have COVID documents, again, they will charge you some countries. So my proposal is to make it easy for those who want to have COVID and
Mr. Abdul, I think we're losing you.
Yes.
Hello, Mr. Abdul? Okay, I think we lost Mr. Abdul there, but hopefully he will call us back for that second question that he wanted to pose. But going to his first question, if we understood you correctly, Mr. Abdul, it speaks to a global or at least an African or even an African regional connectivity with regards to the information utilizing these digital platforms. So as to ease the burden on travelers, for example, if you have this certificate but you lose it, let's say in Botswana, that you are not stranded there, but you're able to access it through another manner, through this connections. We've got Abdul back on the line. Good afternoon again, Abdul.
yeah, good afternoon once again, my sister.
Yes.
Sorry for that wasting, but then I hope that the network will be fine.
Yeah.
Yeah, so my advice is that all agencies that are operating in COVID directives, you make it easy for those who want to have the document that you have said. Okay? I know what you say, that so that all countries who are connected in giving by east, west, north, or south in the world, Africa, Asia, whatever that person is traveling, he can able to have this document registering in the system directly, not indirectly, because what is happening is it is indirectly. If I lose my document and I already been having whether paid or not paid, it's something which I will be lose. Documents you can lose it. ID card you can fall down. You can fall the passport. So if it's already in the system, then the moment I punch my information, then that information can already be given by the system from that country that this person is coming from South Africa or Nigeria, is going to America or is going to Kenya, whatever country. Then whenever he is going to reach that country, all information is being attached. So this is what I'm trying to say, to prevent that certain embarrassment or certain delaying, and most of the customers are passing by different, like for example, I'm transiting. If I'm doing transiting and then I'm going to be again up and down to get all these documents. So before that person travels, make sure that those who already have wanted to have, let them, like you said, they're able to go to the nearest hospital, whatever places, clinic, whatever hospital. You punch all the information that they need to have collectively, and then you punch it before they leave the country. And then for the other side, now if I'm not going to have that document, what is the purpose of me be blocked over because of my country is not connecting with the other country who are not having documents that are not fully agree over the COVID registrations documents that are presented from other countries. What are you going to say about these people? How are you going to protect these people from this type of blockage from the other countries which are not connected from them agreeing their citizens to pass over their border or the country airport? How are you going to help them? Thank you very much.
Okay, thank you very much for your participation, Abdul.
Okay.
I'll pose the questions. Same to you. So I think he came back and he very much clarified what his points were. I'll allow you to respond to those.
Thank you very much, Abdul, for posing that question. I'm happy to hear this type of a question coming from the public, or member of the public for that matter. I think you have already touched on a desire that every country is actually looking forward to, and that is systems interoperability. Of course, this is a bigger project, but what I can say right now, countries are implementing different systems, each one of them, and the desire is to make sure that the systems interoperability, of course. This is a very, very difficult assignment, but of course, it is something that countries are actually, working towards. This particular system that we have implemented, we are saying it is digital. So once you create an account and you generate a digital certificate, obviously your digital certificate will remain on that account. So whether you have lost gadgets and you happen to know your password, which you can as well reset once you forget about it. So it is unlikely that you will be unable to have access to your digital certificate for as long as that account exists and you know your password or the functionality of resetting that exists. So with that, I'm seeing minimal chances of you or people having, incidences of not having access to the digital certificate or losing it. You will of course lose it once you print a paper out of it, but of course you will still have access to it because it will remain on your account forever. For as long as we are using this particular system. But of course, we welcome the idea and the proposal. And of course, this is what countries are working towards in making sure that systems are interoperable and they share information across the regions and continents. Thank you, Abdul.
The next point that Abdul had there was, how are we as a country, our leaders, if I can place it that way, what are we putting in place, or what are the measures that we're putting in place or adopting to try and protect our citizens that are being barred from other countries because they choose, for example, not to be vaccinated, or they don't have digital certificates, which in most cases, those that are requesting for are are requiring it for the purposes of knowing whether or not the individual is vaccinated. How are we then as a country going to protect our citizens from this, for lack of a better word, it would be segregation?
Well, thank you very much for that question. In fact, I honestly feel that we will have a limited chance to convince other countries to change their entry requirements. I can give you an example. We have engaged, for instance, our counterpart South Africa, when this digital certificate requirement started from the other side, and their responses, of course, remained that they do understand, but of course they responded to mean that they stand by their requirements. It's unfortunate that an individual chose not to be vaccinated, but I may not be actually really in the position to say there is anything that is currently ongoing to implement to protect this current individual. But of course, the mechanisms that are there could be diplomatic channels or diplomatic relations.
Yeah.
But of course, as we speak right now, I don't think we do have information relates to how we can actually protect. But if it is a question that can be actually addressed at another platform.
Yeah. I'm sticking to global relations. It comes back to the question that I had earlier on. This whole global vaccination certificate template. Is there one that you're aware of that is in the making or not?
I don't think that we can call it to say that there is a global specific framework or requirement. But what I can tell you is that, and tell the public, is that WHO has passed on requirements or guidelines on how countries should approach the implementation or development of this digital certificate. So these are guidelines that are given out, but the guidelines are guidelines, obviously, and countries may actually implement, aligning their implementation using the WHO recommended guidelines in terms of the features that should appear on the digital certificate.
Okay, but in the meantime, while we wait for these global templates, if they're ever to be formulated, is there an official Namibian format that these uploaded details have to be in, or are any and all accepted? And this I state taking into consideration that there are a multitude of laboratories that are conducting, let's say, the PCR tests. And then we also have vaccinations that are being done at various health facilities in the country and various points, even with the campaigns, the vaccination campaigns that the ministry is also busy with. It's at various points. So that's the question: is there a Namibian format that we are requiring for a person to, follow, if I can put it that way? But before we get to that question, we've got Kat from Windhoek on the line. Good afternoon. How are you? Hello.
Hi, good afternoon.
Good afternoon, Kat. How are you?
I'm well, thank you. I applied for the digital vaccination certificate about a week ago on the 26th of May.
Yes.
I only learned on that day that I needed to travel to South Africa for business on the 4th of June. And I submitted the application. It's still not been verified.
Yeah.
I would like to find out, why does it take so long for our certificates to be verified, whilst in South Africa they can get it the same day verified?
Okay. No, thank you very much, Kate. I will definitely pose that question to Mr. Nakafimbo.
Thank you.
Thank you.
All right. Yes, thank you very much, Kate, for asking that question. It's the same question that we get quite often. Like I stated, I would like the public to be clear on this one. The trusted travel system happens to be a separate system from our vaccination data records, or system that is actually capturing our records.
Yes.
In this case, we are actually referring to it as DHIS2. Although we have tried to link it to the system, to trusted travel, this DHIS2, the verification, once individuals have actually uploaded their records, the verification process requires that we check against the database. And, it happens that the team that we have, even if it's actually a very helpful team, is actually very limited and stretched.
Yeah.
And those are the reasons why, the verification, duration of verification is actually taking a bit longer.
Yeah.
But I would like to bring a particular example. It is not foreign to find a number of days or weeks actually attached to a system, particularly when it is a new system. I'll give you an example of when we are, for instance, applying for our passport at the Ministry of Home Affairs. It's a process.
Yes.
People probably need to verify a number of things before they issue. They want to know whether what you have actually uploaded is your document.
Yeah.
It is the same that at the Ministry of Health, we may also want to confirm that indeed what the person have uploaded is actually correct.
Yeah.
There are quite a number of also technical issues in the system that we are busy working on that are also making us to have a bit of delay. But I would like really to ask the public to be patient as we are working towards actually addressing some of these technical glitches that we have picked up on the system and so forth in terms of verification also. But of course, I do admit that the verification takes a little longer, but it is something that we have also noted, and we are working with the technical team, the Pan-Bios Consortium, to come up with strategies on how to improve that area. Okay. In the absence of having that digital certificate, unfortunately available at the time that you need really to board a flight, unfortunately, we are requesting the public to make sure that they do the PCR test as another second option or requirement that the destination countries may be requiring.
Okay.
Yes.
Okay. So basically what we're saying right now is that South Africa is still accepting the PCR tests if they're within the required time frame.
Exactly.
As per the travel regulations.
Exactly.
Okay.
Exactly.
So Kate, hopefully that has answered your question. And as a second option, just to make sure that you do not, fall victim of the system, if I can call it that, just make sure that you get a PCR test done that you can use to travel with, in that case that your certificate is not ready. It brings us back to the question that we had earlier on. Do we have an official Namibian format?
Yes. I really do not know what you are expecting in terms of the format, but the digital certificate is actually customized, with that specific format that we are issuing it. I don't know, the vaccination certificate or the vaccination card itself is also customized with a specific format, and I think the public by now, those ones that were vaccinated would be able to tell that once you are vaccinated, this is the card that you are getting.
Yeah.
But for the vaccination, digital vaccination certificate, obviously, we have actually developed that specific, we customize that format in the system.
Okay.
And that is what is being issued. But however, so that is not necessarily, the format is not necessarily going to be the most important thing. What is going to be important is the uniqueness of the QR code and the number that is actually there. That is the one that is unique to you. Okay. So you may have the same format, so you can actually copy maybe a certificate of someone else and put your details there. But if that number will remain connected to the other individual, and that is where we will actually get you. Okay. So the verification of this particular certificate is done once we have introduced it actually in Namibia or at our airport, airport health officials also participating. There is a specific account specifically for port health official that is customized to verify that what you are presenting indeed was generated from trusted travel.
Okay.
And that is the number that they are using. If we are sharing the number, that is where we will actually identify or pick it that. So these are counterfeit. This is a counterfeit digital vaccination certificate. Okay. Yes.
Wow. As I said, COVID-19 has definitely woken us up to the utilization of digital platforms, and also in trying to make sure that we mitigate unauthenticated documents through these same platforms. Our next question goes to the loss of documents. What happens if a person who has lost their, let's say, the vaccination card, the physical card itself, before they could upload it or before the time that they need to upload it onto the system for purposes of travel or so on. Does the ministry have a database for all the people that were vaccinated, and will the ministry be in a position to reissue a person with a vaccination card?
Very good. No, thank you very much indeed for that question. It's a question that also kept popping up, and we have been addressing it on individual basis. The ministry is having a database that is, keeping the records of vaccination for all those ones that are vaccinated. The only unfortunate part of it is that we are kind of having a little bit of a backlog, that your record and my records most likely not to be yet captured, as we are actually working on clearing that backlog. Yeah. The backlog came because the introduction of that system came way some months after we have actually already started vaccination. Okay. But it is a project that we are also winning. In the event that you lost your vaccination certificate, there are chances of verifying that indeed you are vaccinated. You give us your details and we check that your records are on the system, and that will actually create an opportunity for you to be given a duplicate of the vaccination certificate. But we are advising the public to go, where they were actually vaccinated, and that is where they can actually be issued this duplicate. But that can be done after the team have confirmed that indeed your records are there.
Okay, that's tricky, because, for example, somebody was vaccinated at, let's say Lady Pohamba.
Yes.
A medical vaccination point. And since their vaccination, this point is no longer
very good.
A spot for vaccination. How do they then go back to where they got vaccinated?
No, I expected that clarification. The points are actually, when the points were elected, the points of vaccination were falling under a specific district office. Yeah. And that is where they have to go. For instance, most of these points that we are actually having in Windhoek, for instance, they are falling under the Commerce region or Windhoek district, and that is where, we are advising the public actually to engage. Okay. So we are not necessarily, but of course, it is actually because, these are the people that will have the institutional memory. It can also be people that are having access to some of these paper records that were used there if they were not yet captured. Of course, that we are saying in this moment in time. This is not yet an official arrangement that we communicated officially, but of course, that is the immediate measure that is available. So people can actually go to the respective districts under which that vaccination points, fell that particular time.
Okay.
Yes.
So if my understanding is correct, a region has multiple districts.
Yes. And
is the district attachment to vaccination point available on your websites?
That one is actually maybe information that really need to be sent out to the public specifically if that needs to be. But of course, we do not have that arrangement. But we do have district and regional informations that are there. Maybe the what we call the health facility, the master facility health list, or list facility, the master health facility that we have, maybe also a complicated version also for the public to understand. But I think it's a point well taken. Yeah. We will actually, it's something that I can actually take back to the office and engage my colleagues on how we can maybe possibly address this. Because it appears that it might actually, be an issue. Yeah.
Well, we have come to the end of our show for this afternoon. We would just like to ask Mr. Nakafingo to give us your last closing remarks to the nation.
Very good. Yes, thank you very much for this opportunity. And thank you very much, the public out there. What I would like really to indicate and ease out is that it is not foreign for a new system like this to be kind of having some challenges. Many new systems that are being implemented comes with their different challenges. Yeah. The good news is that we are familiar of the fact that, or we are aware of the fact that there are quite a number of challenges, and we have taken note of them, and we are actually working towards improving or addressing some of these challenges. What I would like again to leave the public with is is patience. We also do not necessarily want to open up this system to quite a number of, an increased number of people that are doing the verification process until we are comfortable that, we actually, cascading it down to different, points as we go. Okay. But if we are going to remove the verification process, then it will defeat the process or the purpose of us implementing a system that is tamper-proof, that is free from counterfeit, documents that are being produced out of it. So in this case, I really want to ask the public to be patient and also to be of cognizance of the fact that this is a new system that is implemented in a community or a population where computer literacy is also not at that level.
Yeah.
Yes.
Okay. With that said, we would like to thank Mr. Nakafingo for availing himself to come and assist us in understanding the system. As he said, it's a new system, and a new system needs us to be educated with regards to how it works, and also just to be reminded that there is the website that you can go onto in order to place your application for this digital certificate, and also where you get stuck and where your neighbors can help you, please do not hesitate to call the call center number, which is 0800 100 100. That is 0800 100 100. 0800 100 100. That's the call center for the Ministry of Health,
sure.
I believe.
Correct.
And they are very much in the position to assist you. At this point, myself, Shianwa Desire Kahiha, and my production crew would like to thank you for joining our session this afternoon. We'll see you again tomorrow. Bye-bye.